Chest pain is one of the most misunderstood warning signals the body can give. Sometimes it's harmless. Other times it can signal a life-threatening emergency. The problem is that many people either ignore it when they shouldn't or panic when it's not necessary. Knowing the difference matters. Most adults will experience chest discomfort at some point in their lives. It might feel like pressure, tightness, burning, sharp pain, or even a strange heaviness. The challenge is that chest pain does not always look the way people expect. Movies often show someone clutching their chest and collapsing, but in real life the warning signs are often more subtle. Understanding how chest pain behaves and what symptoms appear around it can help you recognize when something might be serious. One of the first things to understand is that chest pain can come from many different parts of the body. It is not always the heart. The lungs, muscles, digestive system, and even nerves can all produce pain in the chest area. For example, acid reflux can cause a burning sensation that feels very similar to heart pain. Muscle strain from lifting or physical activity can create sharp or aching pain that worsens when you move. Anxiety can also cause chest tightness and discomfort. Because so many systems are involved, the location of pain alone is not enough to tell you what is happening. Instead, the body usually gives additional clues. One of the most important warning patterns is pressure or squeezing in the center of the chest. Many people describe it as a heavy weight sitting on their chest. This type of sensation can sometimes spread to the shoulders, arms, neck, jaw, or back. When this happens together with symptoms like shortness of breath, sweating, nausea, or unusual fatigue, it may indicate a serious heart problem. Another pattern that deserves attention is pain that appears during physical activity and improves with rest. When the heart struggles to receive enough oxygen during exertion, the body may respond with chest discomfort. If someone notices pain repeatedly appearing when climbing stairs, walking quickly, or carrying heavy items, that pattern should not be ignored. Sudden and severe chest pain can also be dangerous, especially if it appears without a clear reason. Pain that feels tearing, ripping, or extremely intense may signal a serious problem involving blood vessels in the chest. These situations require immediate medical attention. However, not all dangerous chest pain is severe. In some cases, the pain may be mild but persistent. A dull pressure that lasts for many minutes or continues to return throughout the day can also be a warning sign. Another detail many people overlook is how the pain spreads. Pain that travels from the chest into the left arm is commonly discussed, but discomfort can also move into the jaw, upper back, or even the stomach area. Some people experience unusual fatigue or lightheadedness along with chest discomfort. For older adults, symptoms can be even less obvious. Instead of intense pain, they might feel weakness, dizziness, or shortness of breath without a strong chest sensation. These quieter warning signs are one reason serious heart problems are sometimes missed early. On the other hand, some forms of chest pain are more likely to come from muscles or joints. Pain that becomes worse when pressing on the chest wall, twisting the body, or taking a deep breath is often related to the muscles between the ribs. Digestive problems can also create chest discomfort. Burning pain that appears after eating, especially when lying down, may be related to acid reflux. While uncomfortable, this type of pain usually behaves differently from heart-related pressure. Even so, the body does not always follow simple rules. Two people can experience the same condition but feel completely different symptoms. That is why it is important to look at the overall pattern rather than focusing on a single detail. There are a few key warning signs that should always be taken seriously. Chest pain that lasts more than several minutes, pain that spreads to the arms, jaw, neck, or back, shortness of breath appearing together with chest discomfort, cold sweating, nausea, or sudden dizziness, chest pressure that appears during physical activity. These signals do not automatically mean a life-threatening condition is happening, but they are important indicators that the body may be under stress. One helpful way to think about chest pain is to observe three basic questions. First, how does the pain feel? Is it pressure, sharp pain, burning, or tightness? Second, when does it appear? Does it happen during movement, after meals, during stress, or randomly? Third, what other symptoms appear at the same time? Breathing changes, nausea, sweating, fatigue, or dizziness can all provide important clues. When these pieces are observed together, the situation often becomes clearer. The key insight is that dangerous chest pain rarely appears completely alone. The body usually sends multiple signals at the same time. The challenge is learning to notice patterns instead of focusing on just one symptom. Many people dismiss early warning signs because they expect dramatic symptoms. In reality, serious conditions often begin with subtle changes that slowly become more noticeable. Paying attention to how the body behaves, especially when new patterns appear, can make a major difference. Chest pain should never be ignored when it is unusual, persistent, or combined with other symptoms. While many cases turn out to be harmless, understanding the warning patterns helps reduce the risk of overlooking something important. Learning these signals does not require medical training. It simply requires awareness of how the body communicates stress or imbalance. If you found this explanation helpful, consider subscribing to the channel for more clear breakdowns of common health warning signs. These videos focus on practical patterns people often overlook in everyday situations. You can also check the description, where there is a helpful resource that organizes several of these warning signals and practical health situations in a simple and structured way. It's a useful place to review the details discussed in this video and explore the topic a little further.